Hello, friends. Today, again, we are going to discuss another important topic. Your bad oral health can give you heart attack. A dentist, Kemi Hoss, says oral health is another essential piece of the puzzle when it comes to staying healthy. I am Dr. Jagaji Singh Virk, MBBS, FCGP, FAMS, PGDGM. Key facts about oral hygiene. Oral diseases, while largely preventable, pose a major health burden for many countries and affect people throughout their lifetime, causing pain, discomfort, disfigurement, and even death. It is estimated that oral diseases affect nearly 3.5 billion people. Untreated dental caries, tooth decay in permanent teeth is the most common health condition according to the Global Burden of Disease 2019. Treatment for oral health conditions is expensive and usually not part of universal health coverage. Most low and middle income countries are unable to provide services to prevent and treat oral health conditions. Oral diseases are caused by a range of modifiable risk factors, including sugar consumption, tobacco use, alcohol use, and poor hygiene, and their underlying social and commercial determinants. What is oral hygiene? Oral hygiene is the practice of keeping your mouth clean and disease-free. It involves brushing and flossing your teeth as well as visiting your dentist regularly for dental x-rays, examinations, and cleanings of the tooth. What are the signs of poor oral hygiene? Here is a look at some of the most common signs of insufficient brushing, flossing, and other oral hygiene practices. Tooth pain. If you notice pain in your tooth, do not ignore it. It is very, very hard to tolerate tooth pain. Bleeding or swollen gums shows the inflammation around it. Alterations to the tongue, whether there is some inflammation, some ulcers, or some other problem. Growths within the mouth may be a cancer. Deteriorating gums, halitosis, that is bad breath, sensitivity of the teeth to the cold or the hot, tooth mobility, if the tooth is loose and moving. What are the types of oral hygiene? Here are some of the most common oral hygiene aids for home care. Dental flosses. Dental floss is the most common interdental and subgingival below the gum cleaner and comes in a variety of types of flavors. Interdental cleaners, mouth rinses, oral irrigators, rubber tip stimulators, tongue cleaners, and toothbrushes. What are the three oral hygiene diseases common? Some of the most common diseases that impact our oral health include cavities or tooth decay, gum or periodontal disease, and oral cancer. Why dental hygiene is important to your oral health? Because it reduces your risk of developing tooth decay and gum disease. When left untreated, both tooth decay and gum disease can have serious implications on your oral health. Both of these oral health problems are caused by excess bacteria. Those are pathogenic, either on the tooth enamel or around the gums. Dental hygiene as a way of preserving your natural teeth, facial structure, and bone mass. Poor health and general health. Poor oral health and general health. While the specific relationship between poor oral health and the development of certain medical conditions is still being researched, studies have shown there is a possible connection between the two. Currently, research has found that poor oral health can contribute to the following health conditions. One is diabetes, endocarditis, pneumonia, pregnancy complications, cardiovascular disease, rheumatoid arthritis. In rheumatoid arthritis, Porphyromonas gingivalis DNA is present in the synovial fluid. Breast cancer, lupus, inflammatory bowel disease, Crohn's disease, ulcerative colitis, multiple sclerosis, preeclampsia, maternal hypertension, Alzheimer's disease, chronic kidney disease, and hearing loss, and many other autoimmune diseases. Poor oral health and heart disease. Gum disease, periodontitis, is associated with an increased risk of developing heart disease. Poor dental health increases the risk of a bacterial infection in the bloodstream, which can affect the heart valves. Oral health may be particularly important if you have artificial heart valves. Can poor oral health lead to heart attacks? The more surprising observations in recent years, study after study has shown that people who have poor oral health, such as gum disease or or tooth loss, have higher rates of cardiovascular problems, such as heart attack or stroke, than people with good oral health. Is there a link between dental plaque and heart disease? The plaque that forms on your teeth is the same type of plaque that builds up in your arteries and causes heart disease. Plaque buildup in your arteries becomes a serious problem when the buildup of plaque on the walls of your arteries narrows them and restricts blood flow. A complete blockage can cause a heart attack. Oral health and lung disease. Dental plaque can host respiratory pathogens that can be released in saliva and can then be aspirated in the lungs. Pathogens can also enter the bloodstream through the bleeding gums in patients with poor oral health and disseminate to the lungs, causing a local infection. 10 ways to keep your oral hygiene. Don't go to bed without brushing your teeth daily. Brush properly from upper teeth from above to below, and for lower teeth down to above. Pay attention to your tongue with tongue cleaner. Use a natural toothpaste. Treat flossing as important as brushing. Use mouthwash. Drink more water. Eat crunchy fruits and vegetables. Limit sugary and acidic foods. See your dentist at least twice a year. But vitamins strengthen teeth. Vitamins and minerals for strong enamel. Calcium is the one of the most important minerals for healthy teeth because it helps strengthen your enamel. Vitamin D is another, vitamin C is another, phosphorus, vitamin A, and vitamin K. Which nutrient deficiency causes tooth decay? Vitamin A deficiency leads to impaired epithelial cells, which are responsible for secreting calcium, phosphate, magnesium, and carbonate oils that help form enamel and a healthy tooth. A vitamin A deficiency results in poor enamel, enamel with pits, or enamel with increased porosity. Natural ways to improve oral hygiene. Oil pulling. Don't snack frequently. Eat mineral-rich foods. Remove refined sugars from your diet. Remove grains from your diet because of phytic acid. Clean your tongue regularly. Eat foods high in fat-soluble vitamins. Improve digestion for absorption. Stay hydrated. Use a fluoride-free toothpaste. Chew sugar-free gum. Treat stomach issues. Treat teeth grinding and clenching. Proper brushing techniques. See the dentist regularly. Oil pulling. Any high quality edible oil, maybe coconut oil, sesame oil, or sunflower oil, may be used. A tablespoonful of oil is swished around the mouth in the early morning before breakfast and in empty stomach for about 20 minutes. To maximize results, try to oil pull at least a few times per week or up to 3 times per day. When you first start, you can swish for about 5 minutes and gradually increase the duration until you are at 20 minutes. Keep teeth clean and it removes built up plaque and it removes bacteria in your mouth. Thank you very much.